Welcome to the fall semester at Eastern Iowa Community Colleges. There's no place like home, and there's no place like EICC. In this training, you will learn what the college is doing and what you can do to make this a safe environment for you and your fellow students.
Eastern Iowa Community Colleges is happy to welcome new and returning students back to campus for the fall 2020 semester. Our top priorities for the semester are the health and safety of our students, faculty, staff, and the communities we serve, as well as providing critical education and training needed by our students to survive and thrive in the current pandemic environment. We have incorporated public health guidance, the best data available, and lessons learned from our summer reopening to design a flexible, academically rich, supportive, and safe experience for students. You will find our campuses to be COVID-aware learning environments, our class schedule to be flexible, and our support services committed to your success. In response to COVID-19, we are committed to providing you a COVID-aware learning environment, a flexible class schedule giving you the choice of face-to-face classroom instruction, live online, and traditional online classes. And we are committed to supporting your success, making sure you achieve the goals you have set out for yourself. This training focuses on creating a COVID-aware learning environment.
EICC is creating a COVID-aware learning environment by requiring all students, faculty, staff, and visitors to wear face masks on campus, requiring students, faculty, and staff to stay home and not come to campus if they are ill, experiencing symptoms, test positive, or may have had close contact with a COVID-19 positive individual. To understand what close contact includes, a risk assessment is available on our website at eicc.edu/welcome20. Rearranging classrooms and common spaces to provide at least 6 feet of social distancing, implementing prevention, mitigation, reporting, and monitoring initiatives, training students, faculty, and staff on public health guidelines, and maintaining public health awareness through regular communication. Face masks are required at all times on campus. This includes classrooms, labs, offices, service spaces, common study spaces, and outdoor campus spaces. We encourage you to find a face mask that best fits your face, stays put, and covers your nose. You will be required to wear them daily when on campus. Please consider acquiring more than one mask for your use. We recommend at a minimum 2 cloth reusable face masks and 2 disposable face masks. Carry them in your car, your backpack, or your purse to ensure you have one ready when you arrive on campus. It is important you wear your mask correctly. Begin by washing your hands before putting on your mask. Place the mask over your nose and mouth and secure it under your chin. Try to fit it snugly against the sides of your face, and make sure you can breathe easily. Wearing a mask helps protect others. You may not know you have COVID-19. Wearing a mask that covers your nose and mouth helps protect others in case you're infected with COVID-19 but don't have symptoms. Wear a mask in public settings when around people who don't live in your household, especially when it may be difficult for you to stay 6 feet apart. Wear a mask correctly for maximum protection. Don't put the mask around your neck or up on your forehead. Don't touch the mask, and if you do, wash your hands or use hand sanitizer to disinfect. Take off your mask carefully when you're home. Untie the strings behind your head or stretch the ear loops. Handle only by the ear loops or ties. Fold outside corners together and place your mask in the washing machine. You can learn more about how to wash masks at the link on your screen. And be careful not to touch your eyes, nose, and mouth when removing, and wash your hands immediately after removing.
Face covering do's and don'ts. Do. Make sure you can breathe comfortably. Wear it whenever going out in public. Make sure the mask covers your nose and mouth. Wash after using. Don't. Use with children under the age of 2. And don't use surgical masks or other PPE intended for healthcare workers. What is social distancing? Social distancing, also called physical distancing, means keeping a safe space between yourself and other people who are not from your household. To practice social or physical distancing, stay at least 6 feet, that's about 2 arms lengths, from other people who are not from your household in both indoor and outdoor spaces. Social distancing should be practiced in combination with other everyday preventative actions to reduce the spread of COVID-19, including wearing masks, avoiding touching your face with unwashed hands, and frequently washing your hands with soap and water for at least 20 seconds. The college has configured classrooms, labs, computer labs, libraries, and other common study space to allow for social distancing of 6 feet. Please leave chairs and tables in place to ensure we can maintain that social distancing. Office and services areas have indicators on the floor to encourage spacing. Please abide by all directional signage. When working in small groups with other classmates, we encourage you to maintain social distancing and keep your mask on. On campus, we require both social distancing and masks.
As a member of the college community, your behaviors and actions outside the campus could have an impact on campus health and safety. We encourage you to engage in social distancing both on campus and at your off-campus work and outside activities. When going out in public, it is important to stay at least 6 feet away from other people and wear a mask to slow the spread of COVID-19. Consider the following tips for practicing social distancing when you decide to go out. Know before you go. Before going out, know and follow the guidance from local public health authorities where you live. Prepare for transportation. Consider social distancing options to travel safely when running errands or commuting to and from work, whether walking, bicycling, wheelchair rolling, using public transit, ride shares, or taxis. When using public transit, try to keep at least 6 feet from other passengers or transit operators. For example, when you are waiting at a bus station or selecting seats on a bus or train. When using ride shares or taxis, avoid pooled rides where multiple passengers are picked up and sit in the back seat in larger vehicles so you can remain at least 6 feet away from the driver. Limit contact when running errands. Only visit stores selling household essentials in person when you absolutely need to, and stay at least 6 feet away from others who are not from your household while shopping and in lines. If possible, use drive-through, curbside pickup, or delivery services to limit face-to-face contact with others. Maintain physical distance between yourself and delivery service providers during exchanges, and wear a mask.
Choose safe social activities. It is possible to stay socially connected with friends and family who don't live in your home by calling, using video chat, or staying connected through social media. If meeting others in person, for example, at small outdoor gatherings, yard or driveway gatherings with small groups of friends or family members, stay at least 6 feet from others who are not from your household. Follow these steps to stay safe if you will be participating in personal and social activities outside of your home. Keep distance at events and gatherings. It is safest to avoid crowded places and gatherings where it may be difficult to stay at least 6 feet away from others who are not from your household. If you are in a crowded space, try to keep 6 feet of space between yourself and others at all times and wear a mask. Masks are especially important in times when physical distancing is difficult. Pay attention to any physical guides, such as tape markings on floors or signs on walls, directing attendees to remain at least 6 feet apart from each other in lines or at other times. Allow other people 6 feet of space when you pass them in both indoor and outdoor settings. Stay distanced while being active. Consider going for a walk, bike ride, or wheelchair roll in your neighborhood or in another safe location where you can maintain at least 6 feet of distance between yourself and other pedestrians and cyclists. If you decide to visit a nearby park, trail, or recreational facility, first check for closures or restrictions. If open, consider how many other people might be there and choose a location where it will be possible to keep at least 6 feet of space between yourself and other people who are not from your household. Wash your hands often with soap and water for at least 20 seconds, especially after you have been in a public place or after blowing your nose, coughing, or sneezing. It's especially important to wash before eating or preparing food, before touching your face, after using the restroom, after leaving a public place, after blowing your nose, coughing, or sneezing, after handling your mask, after changing a diaper, after caring for someone sick, and after touching animals or pets. If soap and water are not readily available, use a hand sanitizer that contains at least 60% alcohol. Cover all surfaces of your hands and rub them together until they feel dry. Avoid touching your eyes, nose, and mouth with unwashed hands. Disinfect surfaces and spaces often. The college has enhanced cleaning of classrooms, labs, restrooms, and other common spaces. Disinfectant wipes will be provided for you to wipe down your tables, desks, and chairs when entering classrooms. Students are encouraged to clean off commonly used surfaces prior to use. In labs, we encourage you to wipe off equipment and surfaces between each student's use. Hand sanitizer is available around campus. If a COVID-19 exposure occurs on campuses, any space impacted will be temporarily closed for cleaning and disinfecting.
The college requires all students, faculty, and staff to complete the daily symptom tracker if coming to campus. You will receive information from Health Check 360 on the daily symptom tracker via your college email. Students, faculty, and staff should not come to campus if you are ill, experience symptoms, or may have had close contact with a COVID-19 positive individual. Close contact is defined as contact with an individual within 6 feet for 15 or more minutes. Individuals coming in close contact with a COVID-19 positive individual will be asked to self-isolate until they receive a doctor's clearance or test negative. Individuals testing positive for COVID-19 are asked to notify their college dean of students at the email or phone number below. If you test positive for COVID-19, you will be asked to quarantine for 14 days off campus. You will also be required to provide documentation of a negative result in order to return to campus. Watch for symptoms of COVID-19. People with COVID-19 have had a wide range of symptoms, ranging from mild symptoms to severe illness. Symptoms may appear 2 to 14 days after exposure to the virus. People with these symptoms may have COVID-19. Fever or chills, cough, shortness of breath or difficulty breathing, fatigue, muscle or body aches, headache, new loss of taste or smell, sore throat, congestion or a running nose, nausea or vomiting, diarrhea. This list does not include all possible symptoms. CDC will continue to update this list as we learn more about COVID-19. Keeping in contact if you are ill. If you are ill, tested positive, or been exposed to COVID-19, please contact your instructors via email or Canvas regarding class absences. Your instructors will work with you to best meet class requirements. Possible adjustments may include allowing you to join the class remotely, completing coursework online, or taking an incomplete. If you are ill for an extended period of time, you may need to take a medical withdrawal for the term. Contact your faculty and advisor to determine your best options for completing coursework, taking an incomplete, or withdrawing from classes.
The National Centers for Disease Control have provided the following videos to assist you if you think you have come in contact with someone who has COVID-19 and are experiencing symptoms, including the difference between quarantine and isolation. EICC will continue to update the college community on COVID-19 procedures, changes, or practices. We encourage you to regularly check your college email account for the most up-to-date information. You can also find the college's COVID-19 communications at eicc.edu/COVID-19. In the event of a COVID-19 positive case on campus, it is critical you keep your contact information up to date. Please review your student profile information and ensure the college has updated phone numbers and personal email addresses. Official college communications will be sent to your college email address. Click on the link at the bottom of your screen for more information on updating your contact information with the college. Pledge to support the health of our community. The Eastern Iowa Community Colleges, EICC, are special places where we come together to learn, work, and grow in a safe and supportive environment. As members of the Communities College, we are committed to supporting the health and safety of not only our EICC students, faculty, and staff, but also our friends, neighbors, coworkers, and others in the community in which we live. In order to achieve this goal, we must take steps to protect the health and safety of all members of the EICC community and all those in the communities of which we are a part, following the health and safety recommendations established by national and local public health officials. We know we are all in this together. All students, faculty, and staff are asked to complete the pledge as part of our collective commitment to mitigate the spread of COVID-19. Please read the entire pledge sent to you via email. We encourage you to sign and submit it.
There is a great deal of information available to you regarding COVID-19. You can find additional information and resources at the following links. For COVID-19 medical questions, call your medical practitioner, or, starting August 24, you can call the Health Check 360 medical hotline toll-free at 855-716-2588. For questions regarding the college's COVID-19 policies, response, or assistance, email the EICC Emergency Planning Team at responseteam@eicc.edu, or call the college's COVID-19 non-medical hotline at these phone numbers. For reporting of COVID-19 results or pending test results, please report to the Dean of Students at your college. Details regarding the required Health Check 360 Daily Symptom Tracker online tool will be sent in a separate email to your college email account. Finally, thank you for completing this training, and once again, welcome to the fall semester at Eastern Iowa Community Colleges, the Communities College.